Hi, I'm Beth Payne, and here we're going to talk about leprosy worldwide, but also how it pertains to the US and us. So, first, we're going to talk about the infectious agent, which is the Mycobacterium leprae. So, this is the bacteria that causes leprosy. You can see a rendering of it on the right, that it's rod-shaped bacteria. It does multiply very slowly. So, it's about once every 13 days, it's replicated. And it is transmitted through droplets from nose and mouth, coughing, sneezing, things of that sort. So some of the risk factors are that you must be prolonged close contact with untreated cases. So being with people for a really long time, you can't get it from somebody hugging you or being near you in the subway, things like that. It does take a long time for you to acquire it. And then if you are residing in a country where leprosy is widespread. Here in the image, you can see some of the countries that are the dark gray, where leprosy is still pretty prevalent. So Brazil, India, countries of that sort. And so to learn a little bit about leprosy itself, so the bacteria that we just learned about attacks the nerves in the body. And it's a chronic infectious disease with an average incubation period of about 5 years. So when we just learned how long it took to replicate the bacteria, that kind of plays into this incubation period. But it can take up to 20 years for symptoms to appear. So people might be spreading it without really knowing. Some of the symptoms are skin lesions, discoloration, and nodules or growths on the skin, so hands mostly that you'll see, and then enlarged nerves and numbness. It can impact all kinds of areas on the skin, so you're around your eyes, your hands, ears, things of that sort. And if it is left untreated, it can lead to paralysis and other nerve damage. So with susceptibility and diagnosis, children are more likely to acquire leprosy because 95% of adults' immune systems can fight off the bacteria itself. And once a patient is treated, they no longer are able to transmit the disease. So there is a way for us to control it. And with testing, it's really that diagnosis is done clinically based off of symptoms and if they've had a lot of exposure. There is a way to do testing and confirmation in a laboratory, but that's really mostly for really difficult cases to diagnose. So locally, how it can pertain to us. So although it is rare, there is still about 150 to 200 cases a year that are diagnosed here in the United States. And one way that it can be transmitted is through armadillos. So some armadillos naturally carry the bacteria that causes leprosy. So the American Academy of Dermatology Association says to never handle an armadillo. So again, one thing that we can do to help this is help people get diagnosed and treated so they stop transmitting if we know that they have had these risk factors that we talked about. But I wanted to focus on breaking down the stigmatization of this disease. So you can see here from the CDC that leprosy is one of the world's most stigmatized diseases, and people can be denied basic human rights because of that. And we just want to break that down. So it can happen in the US and in our area, and we just want to make sure that we are taking care of people with our communications strategy as well. So I've included some talking points here to share with people as you are doing your work around this disease. So it's curable. It's not the same as we know leprosy historically or in religious text. It's different these days. It's not very contagious. Fingers and toes and arms and limbs don't fall off from the disease, although some things can happen if it's left untreated, with fingers having lesions and things like that. It's not the same as has been talked about previously. And people that have leprosy are able to be treated, they stop transmitting, and they really can live normal lives. So that is all I have for today. Here are my references. Thank you.